السلام عليكم ورحمة الله. Gastrulation and neurulation. Now we are in the second week. This lecture is regarding to the third week. And all the event here occur in the third week. طيب. What is the first event which is very important? Named primitive streak. Primitive streak. What means by the primitive streak? It is very important this event to occur to continue the further development. يعني the further development depend on the occurrence of this event, primitive streak. What means by the primitive streak? This is the epiblast, bilaminar embryonic disc, epiblast. And below here, hypoblast. This is the embryonic disc. يبقى epiblast, and this is a hypoblast. This is the cranial end of the embryo. Cranial near the head. And this is the caudal end of the embryo or embryonic disc. What means by primitive streak? The cells of the epiblast at the caudal end, يبقى epiblast هي upper layer at the caudal end of the embryo, increase in number, proliferate, increase in number. So the cells of the epiblast at the caudal end increase in number. What is the name of this event? Primitive streak. When it is starting in the third week and will disappear in the fourth week. يعني start to develop, then disappear again in the fourth week. And after disappearance, this remnant of these cells will be in the sacral and coccygeal region. Sacro and coccygeal region. So this is the first story. What about the primitive streak? يبقى primitive streak, the cells of the epiblast at the caudal end of the embryo increase in number. What is the role of the development of the primitive streak in human? It is very important to continue the development of the embryo. Very important to continue. Yeah, so streak means continuation. يبقى primitive streak in the third week, increase in number of the cells of epiblast at the caudal end. And what is the fate of the primitive streak? It disappear by the end of the fourth week, and it's remnant in the sacrum and the coccygeal. طيب, what are the abnormalities of the primitive streak? If this remnant of the remnant of these cells persist, يعني these cells will persist, not disappear, will make a large or give rise to large tumor in the baby after birth. And this tumor very big like that. What is the name of this tumor? Sacrococcygeal teratoma. If you open this tumor, you will find all type of the tissue inside. You will find the hair, teeth, muscle, bone, and so on. So what is the name of this tumor? Sacrococcygeal teratoma. Sacrococcygeal teratoma. This is the first one. The second event, this is the epiblast. And this is the hypoblast. This is the cranial end of the embryo. This is the caudal end of the embryo. What happened in this story? In the hypoblast, there is a circular thickening at the cranial and the circular thickening at the caudal. يبقى thickening of the hypoblast at both cranial and the caudal end of the embryo. The thickening at the cranial end, what is the name? Pre-caudal plate. And what is the name of the thickening at the caudal end? cloacal membrane. Precaudal plate will give the future mouth. and the cloacal membrane will give the future anus. So this is the second story for this week. يبقى we have two layer, epiplast, hypoplast, and the hypoplast we have two circular thickening. What that at the cranial and what at the caudal. What is the name of the cranial end? The precaudal plate. It is will be the future mouth, and at the caudal end will be cloacal membrane. This is the future anus. The third story is very, very important about what is the name of the gastrulation. Gastrulation. What is the meaning of the gastrulation? We have here epiplast, we have here hypoblast, and both layer are named bilaminar embryonic disc. In the third week, the epiplast will be named ectoderm. Ecto. And the hypoplast will named endoderm. And a new layer is formed in between, like a sandwich. It is named intraembryonic mesoderm. يبقى we have here three layers. The upper one is named ecto. The lower one is named endo. And in between it is named mesoderm or intraembryonic mesoderm. Now the baby is converted from the bilaminar embryonic disc will be trilaminar embryonic disc. Bilaminar. So this conversion from the bilaminar in the second week to trilaminar in the third week, what is the name of this process? It is named gastrulation. And the embryo is named gastrula. And the starting of the shape of the embryo or the morphology of the embryo. Again, يبقى the conversion of the baby from the embryo from the bilaminar into trilaminar. What is the meaning of trilaminar? يعني ectoderm, endoderm, and mesoderm. And what is the rule or the origin of all these three layer? Epiplast. Epiplast will give ectoderm, endoderm, and mesoderm. What is the origin of all three layers? From epiplast. يبقى all this trilaminar layer from epiplast. Okay. هنا the epiplast, this is cells of migrating from epiplast will forming the endoderm, and some are in between mesoderm. يبقى gastrulation conversion from bilaminar into trilaminar, and starting the morphology or the shape of the body of the embryo, and the baby is named or the embryo is named gastrula, and the rule or the origin of all the three layers, ecto and endo and meso from the epiplast. What are the abnormalities of the gastrulation? We have two abnormalities: fetal alcohol syndrome, which the baby characterized by small head, small eye, no philtrum, thin lip, and cyanomegaly or the mermaid syndrome, which is the fusion of the both lower limb, maybe skin to skin or even the bone, have abnormality in the genital and urinary. Mermaid syndrome and cyanomegaly syndrome. It is named abnormalities of gastrulation. طيب. The story number 4, what is named notochord? What means by notochord? We have here ectoderm, and below endoderm, and in between mesoderm. In the middle of the mesoderm, in midline of the body, we have here a cord. What is the name of this cord? Notochord. هو in the midline and extend from the cranial to the caudal end of the embryo, from cranial to caudal, and lie in the mesoderm. And what is the fate of the notochord? Notochord, like a cord like that, in the midline of the body, will be surrounded by vertebra. This notochord surrounded by vertebra. So the brown color here, vertebra. And also we have here many vertebra. So what happened to the notochord? Like the notochord inside the vertebra will disappear. Disappear. So the notochord inside the vertebra disappear, degenerate. طيب what happened to the notochord in between the vertebra? Like what? Like a small part will give us intervertebral disc, especially the center of the disc. What is the name of the center of the disc? The center of the disc, like fried egg, which is jelly-like, is named nucleus pulposus. Nucleus pulposus of the disc. Again, what are the fate of the notochord? The fate of the notochord, the part of the notochord inside the vertebra disappear. The notochord in between, the brown color, this one, will give us the disc, especially the center of the disc. What is the name of the center of the disc? Nucleus pulposus. The most upper part of the disc, or the cranial part of the disc, will give two skull bone. Skull bone. Occipital bone, to the back bone of the skull, and another bone inside the skull named sphenoid. Sphenoid means butterfly in shape. This is the fate of the notochord. يبقى the part of the notochord inside the vertebra disappear. Between the vertebra will be a disc, nucleus pulposus, and the upper part will be two skull bone, occipital and sphenoid. So this is a fate inside the vertebra disappear, will form between the vertebra as a disc, nucleus pulposus, and the most cranial part will give us occipital bone and sphenoid bone. Remnant of the notochord inside the vertebra, here this is a vertebra by MR, this is a vertebra. And in between the vertebra, this is a disc. Here the vertebra distorted or destroyed by presence of the tumor. What is the name of this tumor? Chordoma. Chordoma means remnant of the notochord inside the vertebra, not disappear, will give a tumor of the vertebra. What is the name of this tumor? Chordoma. Chordoma. The last event of this week, neurulation. What means by neurulation in the third week? Neurulation means we want to, this is a process for the formation of two important structure. Neural tube. We wanted to form the neural tube and the neural crest. طيب, we started the formation of the neural tube and the neural crest by the following process. Number one, will formed from ectoderm. This is the ectoderm. And this is the notochord formed below in the mesoderm. What happened? Over the from the ectoderm, so any neurulation, any CNS, any neural tube, neural crest will develop from ectoderm. At the middle of the ectoderm in the midline, over the notochord, what happened to the ectoderm? The first event هو increase the thickness of ectoderm. Increase the thickness of the ectoderm. يبقى thickness increased. What is the name of this part? Neural plate. يبقى the first one, the process of the neurulation هو formation of what is called neural plate. What is the meaning of the neural plate? Increase the thickness of the ectoderm over notochord. The second step يحصل elevation here and elevation here of the edge. So will be like that, ectoderm, and the edge will be elevated and the middle part will be depressed. So it will be like that. So the ectoderm like here, and the edge will be elevated and the center will be depressed. The elevation, what is the name of the elevation here? Neural fold. The second step, fold. And the third step, depression of the middle part, it is named a neural groove. All this event in the ectoderm. What is the source of the neural tube and the neural crest or the neurulation from ectoderm? The first one, neural plate, increase the thickness. Number two, elevation of the edge, this is named the fold. Number three, depression of the middle part, it is named the groove. What happened later? The fold, and then also this is a fold, will fuse together. It will be like that. Fuse together. The fold and the fold. يبقى fusion of the fold. Of neural fold. This will make conversion of the tube, of the groove into tube. So it will be neural tube. And after that, the neural tube separated from ectoderm. This is the ectoderm. And this neural tube will be separated here, under the ectoderm. This is a neural tube. And around this tube, we have some cells like a crest. What is the name of this cell? Neural crest. So what is the source of the neural tube and neural crest? From ectoderm, starting by formation of the plate, fold, groove, fusion, formation of the tube, separation of the tube, and the crest. This tube like straw. This is a neural tube in the middle of the back of the embryo. This neural tube have two openings. The cranial one اسمها cranial neuropore. Pore means opening. And the lower one is named the caudal neuropore. Must be closed. These pores must be closed. The upper one will be closed at 25 day. The cranial will close at 25 day and the caudal at 27 day. Must close. Must be. After closure, the upper one of the tube, the upper 1/3 of the tube, this part of the tube after closure will dilate. But the lower one or lower 2/3 of the tube not dilate, remaining the same. The upper one could dilate to form the brain vesicle, brain dilatation, and the lower one will be spinal cord. Again, يبقى the neural tube, we have two neuropore, upper and lower, or cranial and caudal, must be closed at 25 day the cranial neuropore and 27 day the caudal neuropore. يبقى الcranial close at 25 and the caudal will be closed at 27. After that, the upper 1/3 dilate to form the brain and the lower not dilate to form the spinal cord. And it is important for the pregnant to take what is called folic acid at the early weeks of pregnancy. Folic acid. The folic acid is very important for the development of the folic acid is very important for the development of the CNS. Folic acid. طيب, what happened if the cranial neuropore not close? The cranial failure of closure. And what happened if the caudal not closed? يبقى the neurulation, formation of the neural tube and the neural crest in the ectoderm. The number one neural plate increase the height of the cell or the thickness of the ectoderm. بعد كده elevation of the edge of the plate fold, depression of the middle of the plate groove. بعد كده fusion of the fold form the neural tube and separate. And this fusion starting in the cervical region, بعد كده separated from the ectoderm and separated with it the neural crest. We have two openings, cranial and caudal. The cranial neuropore will be closed at 25 day and the caudal neuropore will be closed at 27 day. we have here abnormality, failure of closure of the caudal neuropore. This is the caudal neuropore. The caudal neuropore will form in the baby back a sac. This sac may contain nerve, spinal cord, or CSF. What is the name of this case? Spina bifida. الصلب المشقوق. Spina bifida. Spina bifida means failure of closure of the caudal neuropore. طيب, failure of closure of the cranial neuropore. The baby will develop with no brain and no skull bone cap and may be dead. Almost of the cases will be dead. Intrauterine death. What is the name of this case? Anencephaly. Anencephaly. Anen يعني no brain and cephaly يعني brain. يعني so the baby born with no brain, so it is still born. Still born يعني born dead. يبقى spina bifida, failure of closure of the caudal neuropore, and anencephaly, failure of closure of the cranial neuropore. طيب, finally we have to memorize this in a good way. Perfect. What are finally the derivatives? We have two structure for neural tube and the neural crest. Both are developed from ectoderm. يبقى الectoderm will give us in our body two structure, one neuro and one surface. Neuro ectoderm يعني الectoderm give two structure, important structure in our body. Neuro regarding to the nerve, spinal cord and so on, and the surface. Surface means skin, hair, nail and so on. طب what are the neuro ectoderm derivatives? تعال نشوف النيورال تيوب will give us what? A neural tube will give CNS and the PNS. CNS يعني the brain and the spinal cord. Peripheral nervous system will give us retina الشبكية. Will give us pineal gland الغدة الصنوبرية, which is important for sleep. And الغدة النخامية pituitary gland. البيتيوتري gland we have two loop, فصين, anterior and posterior. From the neural tube will give the posterior lobe of the pituitary gland, الفص الخلفي من الغدة النخامية. Again, please, what are the derivatives of the neural tube? CNS, you have to memorize perfect. PNS, retina, pineal gland, posterior lobe of the pituitary gland. Fine. This is regarding to the neural tube derivatives. طب what are regarding to the neural crest derivatives? What neural crest هو the small cells around the tube. All ganglia, autonomic ganglia, ganglia of cranial nerve. Ganglia يعني العقد العصبية. Autonomic and cranial nerve. Schwann cell, which cells surrounding the nerve. Schwann cell. Two layer around the brain. Pia mater and arachnoid mater, which is layer around the brain for protection. Pia mater يعني الأم الحنون. arachnoid mater الأم العنكبوتية. melanocytes, which cells secrete melanin pigment of the skin. And the suprarenal medulla. يعني ايه suprarenal؟ يعني we have a kidney and above it we have a gland اسمها suprarenal gland, الغدة فوق الكلوية, which is important formed of two parts. This gland medulla يعني inner core and cortex القشرة. The neural crest will develop only the inner part, suprarenal medulla. Suprarenal medulla. You have to memorize in a good way. Thank you so much.